Hi. Last time I talked to you about we had an HSG done, and it showed that my tubes were both blocked, and that my husband had a new semen analysis done. The results of his new semen analysis were fantastic. He now had a count of 54 million, and he had 90% motility, and his morphology was really great. That was an amazing little piece of news. I was at work. I was just having a terrible day because I was still kind of, still sinking in that I had two blocked tubes and everything that we had done, the Clomid and having vaginismus and having intercourse is just really painful. And, putting myself through that every month and all the things we had done were all for nothing. And it was really hard to kind of swallow. So getting that news was amazing. The doctor put me on birth control because he wasn't able to get me in for the HSG until cycle day 20, and I usually ovulate on around cycle day 20. So he wanted me to go on birth control so they would stop ovulation. Well, I took it for 3 days. I had to get off of it. On the third day, I had a migraine with aura. If you don't know what migraine with aura is, it's a type of migraine. Um, it's really painful. It's a horrible migraine. But before you have a migraine, you see, mine looks like a lightning bolt. It looks like a lightning bolt, and it starts somewhere in my vision, and it moves over. And it's really odd. Sometimes I don't directly see the lightning bolt because it's like way over here in the corner, and I can tell something's wrong, but I can't see it. I'll be looking at someone's face, and all of a sudden their nose will be gone. I can't see their nose. So about after it takes about 30 minutes for it to go through its process, and once that is done, then the severe nausea kicks in, usually vomiting, and severe sensitivity to light, sensitivity to movement. Even if the air conditioner kicks on and I feel it touch me, it's painful. And my migraines are 99% of the time very extreme. I cannot take medicine. The preventatives don't work. And once the aura comes, which is about 30 minutes before I start having migraine pain, I that's it. There is no medicine to be had. If I take it, it will come up, and it makes it even worse. Once you have a migraine and you're throwing up, it's not worth it. And the medicine that I have tried to take, it really didn't get rid of the migraines. So I just have to go to bed, which causes me to not lose sleep, but it causes me to not be able to work. I'm a salon manager and a pet stylist at a grooming salon, and I book up quite a bit ahead. I have a lot of request dogs. So when I'm out of work, it's not like they can just be booked with someone else or they can just be put off to the next day. I usually don't have anything for a week or 2 weeks sometimes. So it's just a big hindrance. And I also stress out because, I'm really personal with my customers. I don't want to upset them. So I had a migraine on the third day. I didn't even take it the fourth day because I had the migraine, and I had two auras. I had an aura first thing in the morning when a migraine set in, and then in the afternoon, with a migraine set in. And that was it. I was like, I can't do this for 20 days. And, I just looked into, through Google, why it is that they don't want you to ovulate, and it's because of the chance of being pregnant, from what I found. So if that's not correct, don't hold me to it. But that's what I found. And I didn't want to contact my doctor because I didn't want him to put me on for another month, which I know I probably shouldn't have done that, but that's what I did. I knew I wasn't going to get pregnant because I knew we weren't going to have sex. So I just got off of it. As luck would have it, I started bleeding 3 days before the surgery. And I didn't know if I was just spotting at first because my body was out of whack because of hormones or what, but it was a menstrual. So I still didn't say anything because I didn't want to get pushed back again, which, like I said, I know I shouldn't have done that, but I did. He prescribed a tablet that I had to put in vaginally the night before. It was Cytotec. It's supposed to help soften the cervix, and I guess open it up a little bit. And you have to put it in vaginally the night before. Um, well, that was kind of a nightmare. It wasn't easy. It was very small, but it's not easy to put anything in there. So I put it in and I laid down, just crossed my legs and hoped for the best. It stayed in. I got up that morning. I used the restroom. It didn't come out. I went in for my surgery. It was one of my friends and my husband. We all went. It was like 5 o'clock in the morning. Um, they did a really good job. The nurses and stuff like that. They made me feel very comfortable. Of course, I had to take a urine test. Of course, I wasn't pregnant. Um, I did that, and I went and sat down on the bed, and I felt uncomfortable down there. And I decided to just check, and there was the pill. It hadn't even dissolved or anything. It was just barely, and I was like freaking out. And I called the nurse over, and she came over, and I showed it to her, and she was like, "Well, it's too late now." And I was like, "Is it going to be okay? Is it going to be?" She's like, "It's fine. It's fine." So I threw it in the trash can, and the doctor came to see me and just say hi, and kind of remind me what we were doing and stuff to kind of walk me through it. I told him about the Cytotec pill, and he just kind of stared at me for a minute and just continued, and I was like, "Oh God." So the surgery wasn't bad. They were wheeling me away and asking me about my job, and I was not even in the room. They were wheeling me towards the room, and all I remember is saying I was a salon manager. That's all I remember. I was out. The only time I had surgery other than this, I had my gallbladder removed because it was mutated inside of me. I'll put it like that. And I, I don't remember waking up until late, late the night of my surgery. Apparently, I had woken up, but I'm a lightweight when it comes to medicine, and I just I was out. But I think I was so paranoid for the results, or so anxious for the results, really, that I woke up. I woke up before they brought my husband and them back, which I know you wake up before, but I knew I was awake before. I mean, we were back in the room. My husband was watching TV before I even realized anything. And first thing I said, I remember hearing myself say, "What was the results?" And she said, "Your tubes are clear, and you had some cysts and a little bit of endometriosis." And I couldn't comprehend it at the moment, and I was like, "I need to pee." "I need to go to the bathroom." And she was like, "Well, hold on just a minute." And I was like, "No, I have to go now." And she was like, "Well, give me just a minute." And I was already sitting up, like I was just kind of being one of those dumb people, I guess. And she was like, "Okay, let me help you." And I got up and I walked over there. She was trying to help me, but I was just going. Come to find out, I didn't need to pee. It was just the uncomfortable feeling that I felt, I guess, from just my body waking up from that. And I came back and sat down, and I remembered the results. My husband came in and my friend, and they were telling me what the doctor told them, that my tubes were clear, and because I was worried that he wouldn't be able to unblock them, or that I would lose one, those kind of things. And they said I had 3 cysts that were drained, and the endometriosis, which I didn't know I had. And I was like, okay, I took it as that. Um, they let me go home after I pottied. I did. About 30 minutes later, I actually had to really pee, and I went to the bathroom, and they let me go home. And the first day I was fine. I had some good medicine in me. The second day, it was interesting. Of course, I mean, come on, you had surgery. This surgery was very different from my last surgery because it was, sorry, it was up here, and this surgery was lower. And you don't realize how much you use those muscles to get up and get down and do things until you have surgery. So, I was taking Percocet, couldn't take them. I itched all over my entire body. It was ridiculous. And then I had tramadol for the lighter medicine, and it gave me really bad headaches. So I tried to go without medicine, which was really, really interesting. It didn't work out very well. But when I went in for my post op to talk to the doctor, I found out some interesting news. My tubes were never blocked. When they said my tubes were clear, I assumed that meant he unblocked them. It's not the case. They were never blocked. He went in there right away, ran the dye through, they just came right out. The cysts that I had, it was 3 cysts. One of them was very large, about the size of a golf ball. And they drained all 3. And the endometriosis was all on the right side of my uterus. I saw the pictures, and I've seen pictures of endometriosis, like in surgeries and stuff, and this was a lot more than what I've seen in like YouTube videos of surgeries and stuff. So I was really surprised. I asked him, why in the world did the HSG show that my tubes were blocked if they were clear? And he said sometimes they spasm, which I knew that. And then, we talked about the vaginismus and talked about how much pain I was in, how much I was struggling, and that, it really could have added to the stress in my body to make them close up. Which also concerns me for IUIs, because we have to go through the same kind of procedure. And what if my body always shuts down like that? How will it affect IUIs? So, and he said, we'll just cross that when we get there. So the plan is once I started my next cycle, I would come in for a baseline ultrasound, and if everything was okay, no cysts, and all my levels were fine, then we would start our first IUI. I told him that I wanted to do injectables. I did not want to do Clomid or Femera. I wanted to go straight into injectables. I wanted to have better odds, and I wanted to have healthier eggs. Of course, at first he said, there's more of a chance of multiples. And my husband and I had already decided that was fine with us. Because of the vaginismus, we don't plan on going through this to have, we want more than one child. If we can get that at one time, then that would be better for us. No, I don't want 5. I don't want anything crazy. I wouldn't want any more than 3. But the point is that we were okay with the possibility of multiples. We weren't like completely against it. So he said that would be fine. And so anyway, I went home. I went back to work, and work was really crazy because I wasn't supposed to do anything like over 20 pounds. And my first week back, I had at least 10 dogs that were over 50 pounds. It's just how it goes sometimes. I started my next cycle. I called the doctor. I went in for my ultrasound. I had to take Valium an hour before any internal ultrasounds because of the vaginismus. It doesn't stop the pain. I guess it just helps with the anxiety. But I also take I have a muscle relaxer because that helps with the pain. I didn't have any cysts. My lining, my uterus was 7 millimeters at that time, and my ovaries, uterus, everything, measured great, and my blood work was great. So we ordered Follistim. It cost for Follistim and the trigger shot, it was $525, and that was for 300 units of the Follistim. And I was taking 75 units a day. Follistim comes in a pin, and the vial, you just put it in and you just click it to 75 and push it in. Giving myself the injections wasn't so bad at all, actually. I don't like needles, and I was really scared, but it was nothing. Like, really, it was nothing. I will do a video showing you just the Follistim pin and all the stuff. I still have all of it, so I'll show you. the first, they gave me a calendar, and this calendar showed the first day of follicle. Oh Lord, I keep hitting. I'm so sorry. I keep hitting my mic. The first day of follicle was on cycle day. I don't remember. I think 5. And basically, I took it for a little less than a week. Then I went in, and they were expecting to do the IUI like the day after that, which I thought was odd. I know that when they're controlling a cycle, it can be that way, but I know my body. My body is just not going to respond that quickly. That's how I felt, at least. And the doctor's like, it doesn't matter if you usually ovulate late. The medicine kind of controls that. And I was like, oh, okay. Well, we'll see what happens. So I did the 75 units every day for 5 days. I was fine. I woke up on the 6th day to go to the doctor for that follicle scan. And I'm getting ready, putting on my makeup. I was going to go by myself. My husband was sleeping because he worked overnight. And all of a sudden, I can't see my nose. And I'm like, are you kidding me? I'm getting a migraine now? When I get a migraine, that's it. It's shut down. You go in that bed. Whatever's going on, my husband has to call my job, whatever it doesn't matter. If I'm at work, the dog stops getting groomed, and I have to go in the dark room until I can drive or somebody has to come get me. If I'm driving, I got to pull over the side of the road and just go to bed. It's just how it is. So I'm like, I can't go to bed, So I wake up John, and he's, my poor husband, it takes him about 30 minutes to even realize what's going on. And I'm like, just frantic, and I'm like, you gotta get up, you gotta take me to Lafayette. My husband doesn't drive my vehicle, and he's never driven an hour away. He has no idea how to get to the doctor's office. So luckily, the migraine, actually, on scale of 1 to 10, which my migraines are usually 10s, it was only about a 7. So and 7 is bad, but when you're used to 10s, it's like a miracle when you get one that's not so bad. So he did drive, and we got there, and, I told him I had a migraine, but I was doing okay. I didn't have any, I had some nausea, but I didn't throw up or anything. I could not take my Valium or my muscle relaxer, so it was, the ultrasound was really painful. But the ultrasound tech is the same person I see every time, and she's super sweet, and she was really patient with me. Unfortunately, my follicles were really small. They were like 7s. And she was like, oh, you're going to have to take medicine more. But we'll let you talk to the nurse. So I was like, oh, thinking, oh, it's not so bad. They're supposed to, double in 2 millimeters a day or something. But they had not been growing 2 millimeters a day. So we had to order another vial of 300 units of follicle, which was, it was like $300, which we didn't expect to have to buy a second one. So we were like, oh, so anyway, we bought it. Went home, and I was kind of depressed about it, because I wasn't responding. I was like, great. I had to go in 2 days later, and I had nonstop migraines from that point. I was out of work. I had a migraine that next morning. The next afternoon, I had another aura migraine. The next morning that I had to go in for a scan, I had another one. I went into the doctor's office, and I looked like crap. A lot of times when I have a migraine, if I can't fall asleep because of the pain, I will go into a shower and try to just relax, because that's kind of my thing, is warm water. So I did that kind of, I guess, in the middle of the night, not really knowing it. So I looked horrendous, because I don't go take a shower and bathe myself. I just basically let the water run on me. So my hair dried like crazy. I went in there, I had sunglasses on. I couldn't barely speak. My husband had to do everything. I threw up at least 3 times, and they were just like, oh my God, she gonna be okay. And I was like, just do what you gotta do. Follicles still weren't growing. So they made me up it. The doctor, they grew like 1 millimeter or 1.5 millimeters, which by then they should have grown 4. And the doctor said, normally I would cancel, but he said, since you grew a little bit and you're going through all of this, we're just going to up your dosage. So they upped it. Instead of 75, it was 150. So I went home that night and I did a 150. Had another migraine. The next day I did 150, and the next day I went to the doctor, didn't have a migraine. So I was really happy. My follicles were almost there. They were at 15 and a half and 16. But I had a lot of follicles. But I had a lot of like 10, 14, stuff like that. So I had 4 leading follicles basically that were the right size. On Monday, we went in, they measured the follicles. They were, I had a almost positive OPK, and I had CM out the wazoo, which my estrogen rose because my estrogen was really low previously, about halfway through the injections. And they said, they were going to run my blood work, they were going to give me a call, and my follicles were a great size. I had 118, I had 2 17 and a halves, I had 2 16 and a halves, and I had 2 15s, and I had 2 14 and a halves. I had a lot. And, the doctor talked to me, and he said, you have to understand that if you get pregnant with multiples, a high count of multiples, you have to be able to make that hard decision of possible selective termination. And my husband, I have thought about it before and stuff like that. My husband didn't even know what he was talking about, and he said, you guys talk about it while we wait for your blood work, which we did. And we did talk about it, and some people may not agree with this, but we did decide that if it was more than 3, that we would do that. Because the whole reason that you try to conceive and you go through this journey is that you want to take home a live baby. I know that when I first started trying to conceive, it was, get pregnant, get pregnant, get pregnant. But the longer I've watched ladies struggle, and the miscarriages I've seen, and the stillbirths I've seen, and the complications, a friend of mine just lost her baby at 22 weeks due to a chromosomal defect. It's not about getting pregnant. It's about bringing home babies. It's about bringing home healthy babies. So, in order to do that, we were okay with selective termination if necessary. So, anyway, I get a phone call, and they tell me to trigger right away. And we're doing the IUI first thing in the morning. So I was excited, and I was extremely nervous. I've been wanting this for so long, and now it just seems so scary. So I did my trigger shot, which was painful. The other injections weren't painful, but the trigger shot was like the little devil. And it was red and swollen, all that kind of stuff, which they told me it would be. It itched. My husband was sleeping, so when he woke up, I told him the good news. We went in the next day. I did not have a migraine again. Yay. And I took my medicine, the muscle relaxers and the Valium, but I guess because I was so high strung, it didn't even kick in. And I had a music playlist set for the IUI with a couple songs that I really like, and I couldn't get the music to play. And I didn't want the doctor to wait, I didn't want to put him behind by me being ridiculous. Before he did the IUI, he told us that John's semen was really great. His sperm analysis, was really great. It was actually 84 million, and that was 84 million motile sperm. So that was really fantastic news. I thought that since I was excited about the IUI and all this kind of stuff, that it wouldn't hurt so bad. But it did. The speculum, which is a pediatric speculum, normal speculum, I know I'm just showing my fingers, but whatever. It's like this long, and a pediatric one is really small, and it's really small around. I remember saying very loudly, it's cutting me. I can feel it's cutting me. He said, it's not cutting you. It's okay. But when you have vaginismus, it's just closing in on it. It hurts so bad. I can't even explain the pain. I guess for a person who doesn't have vaginismus, it would be like trying to put, something this big around in your lady part. It's really bad. So it hurt really bad. It was really fast, but it was very panicked. I laid there for about 30 minutes instead of 10 minutes, which is what was required, and we left. And I took off the next day and relaxed and went back to work. And I will make another video with the results of that IUI and with my symptoms and stuff like that and how everything went, because this is a really long video, but I wanted to go through the whole first part, the HSG into the IUI. So if you have any questions or comments, please leave them below. I would be more than happy to answer any questions that you have. And thank you for listening to my long story. Thanks, YouTube. Have a good day.